Hello and welcome to the Unit 1 presentation on scope of practice in the nursing profession. These are your learning objectives for this unit. I would recommend that you become familiar with each of them in preparation for class and for the exam. So we'll start by talking about the evolution of nursing. So nursing was started by a woman named Florence Nightingale. And nursing was first based from religion. Nurses were seen as angels. So Florence began by nursing wounded soldiers suffering from physical neglect during the Crimean War. She focused on improving sanitary conditions and a better quality of life for the soldiers, with things such as ventilation, bathing, and good nutrition. She later opened the first nursing school at St. Thomas Hospital in London in the mid-1800s. Today, nursing is a little more technical and there's more complicated information to know. Also today, we focus our interventions and treatments on evidence-based practice. EBP is using research to guide our practice rather than just making things up that sound good. EBP helps to promote health and minimize complications. So for health and wellness, we'll talk about Maslow's hierarchy of needs. This provides a framework to meet patient needs and prioritize care for your patients. Maslow's theory of hierarchy of needs is based on the notion that all humans are born with instinctive needs. The needs are arranged in order of importance, from those essential for physical survival to those necessary to develop a person's fullest potential. So those things on the bottom tier, those physiologic needs, these are necessary for survival. These are things like air, nutrition, water, elimination, rest, sleep, thermoregulation. Safety needs are also pretty important, and these are things like shelter and freedom from harm and danger. The person cannot move to a higher level of needs until the basic needs have been met. So think about how you'll use this theory in your nursing practice. Well, nursing helps people meet the needs they can't meet by themselves. So for example, physiologic needs and safety needs such as fall prevention and pressure ulcer prevention are things the nurse needs to help the patient with. Holism is based on the belief that people can't be fully understood unless looked at as a part of their environment rather than looked at in pieces apart from their environment. Health is more than absence of disease. Holistic health is the thought that the nurse treats the physical, emotional, mental, and spiritual being. Variables influencing health beliefs include developmental, intellectual, background, emotion, spiritual, family, socioeconomic, and cultural variables or influences. Consider these variables incorporate appropriate interventions based on the person's unique characteristics. So we'll talk about the acute versus chronic illness in the illness domain. So acute illness is short-term, often severe, but it subsides. So this could be a broken leg or an appendicitis attack. Chronic disease or chronic illness lasts longer than 6 months, and it also affects functioning. And that's things like diabetes or cancer or any other long-term care. So remember, nursing looks at the whole picture of how the patient and their family experiences illness and promotes health. So we're going to look at personal coping, family impact, and different role strains as well. So we looked at this case study in class. It's here again if you want to think through the answers again. You can go ahead and pause and do that. So scope of practice sets what we are and are not allowed to do based on our healthcare role and education level. One challenge is that nurses are not allowed to make a medical diagnosis or prescribe a medical treatment regimen, even when it's obvious. Understanding your scope of practice is important. So as a UAP or unlicensed assistive personnel, student nurse, LPN, graduate nurse, or RN, wherever you fall, you need to understand what the scope of practice is. It's essential to your practice. Practicing outside of your scope of practice can get you in big trouble legally and ethically. The scope of practice describes the who, what, when, where, why, how of nursing practice for both nurses and for other nursing team members. Your scope of practice is dependent on your education, experience, and role. As graduate nurses, you'll have the skills and tasks to function as a nurse in the general medical setting. You're going to learn about disease processes and focus on assessing and caring for the general medical population. Although you'll have clinical rotations in OB, mental health, and long-term care, you're not going to graduate with a specialized scope of practice. The state boards of nursing are authorized to develop administrative rules and regulations that are used to clarify or make the statutes more specific. License shows public minimum competency and educational requirements to practice safe as an entry-level nurse are met. Rules and regulations must be consistent with the Nurse Practice Act, cannot go beyond the law, and once enacted have the full force and effect of the law. The Wisconsin State Board of Nursing provides a definition of nursing and the scope of practice for nurses from LPN level to the nurse practitioner level. So for licensure, there's a couple things to keep in mind. So you must graduate from an accredited school of nursing and pass the NCLEX to become licensed by the State Board of Nursing in your state. The Board of Nursing can also suspend or revoke your license if you violate provisions of the licensing statute. Interstate compacts exist if you move to another state. And this slide just talks about the different levels of nursing education and how long it takes to get through. After you complete 2 semesters of this nursing program, you can sit for the LPN boards, and just take a minute on this slide and just look at the differences between the LPN role and the RN role. So for delegation, we work a lot with UAPs or unlicensed assistive personnel, and it's important to keep in mind the nurse is responsible for delegating appropriate tasks to the aide. The nurse is also responsible for the work the aide completes, even if the aide doesn't report back to the nurse on things such as low blood pressure or something wrong with the patient. So if we have a CNA that gets a set of vital signs and documents them, the blood pressure might be very low, but the aide doesn't report it, but it's documented, and it happened. Who is responsible for gathering, assessing the data? Well, the RN, whether the data was reported to them or not by the UAP. We want to, anytime we have a physician order, we want to make sure that we're carrying out the medical order unless they're in error, violate policy, or is harmful to the patient. If the order is wrong, you seek clarification from the provider. If the provider confirms the order but you still believe it's inappropriate, notify the nursing supervisor and do not carry out the order. You are legally responsible for harm suffered by the patient. I was just following orders is not a valid defense. HIPAA stands for Health Insurance Portability and Accountability Act. This was a law passed in Congress in 1996 to protect the privacy of patients' records. Medical records are to be electronic and can then be easily transmitted. Patient confidentiality includes using identifiers that protect their privacy. For example, use only patient initials. No case should be discussed in public or with anyone other than those who need to know the information to care for the client. Advanced directives, can be on the chart, and this is where the patient does designate those who can receive medical information. Any documents with patients' names should not leave the agency and should be placed in the appropriate confidentiality bins for discard. Patients designate those who can receive medical information. That info is found in the chart. So what if the patient can't tell us? If it's not documented somewhere that someone can get information, we have to keep it confidential. Nursing students and nurses are held liable for breach of privacy. Substantial financial penalties exist for breach of privacy. So how does our healthcare delivery system work? Well, healthcare is a business. Even nonprofit organizations need to make money to stay in business. Payments from insurance is based on DRGs with special billing codes. DRGs are payments based on diagnosis-related groups. The Joint Commission regulates healthcare organizations. Joint Commission examiners provide accreditation to the agency and ensure that the facility meets regulation standards, or they might not get reimbursed for medical payments. Without accreditation, insurance carriers will not pay for services performed. The Affordable Care Act, or Obamacare, was enacted in 2010 with a goal of having everyone in the U.S. insured. Many insurance companies have opted out due to loss of revenue, and the remaining insurers have raised their premiums, making it difficult for privately insured people to seek health care. The result is a surge in ER visits and further decreased revenue for organizations when patients are not able to pay. So how does this affect how nurses take care of patients? Well, things like acuity or patient, how sick a patient is, staff-patient ratios, prioritization of cares, teaching patients for discharge are all affected. There's also a concern for no-pay events, such as pressure ulcer stage 3 and 4, CAUTI, or catheter-associated urinary tract infection, and falls with injury. These things are considered preventable, and insurance companies likely will not reimburse if they happen. So we have 3 levels of healthcare delivery. In the primary care setting, we have preventive care, such as screenings and immunizations. Secondary care is where elaborate diagnosis and treatment take place, and this is usually in the inpatient setting or the emergency rooms. And where are most resources absorbed, and where are the population's greatest needs? Well, most resources, services, and nursing care or nursing education are in the secondary care, but there's also many needs for specialized knowledge and complex patient monitoring in tertiary care. So it's a delicate balance of resources. So take a few minutes and just think about some places where nurses work and what team members they work with, and jot it down on your notes. And just remember that everyone's job is important, from the provider to the housekeeper. We need to treat everyone as a valued team member. And then I'll have you look up the definitions and functions of the organizations on this slide. It's important to understand the role of each, so go ahead and use the resources linked on E360 for that. Thanks for watching, and have a great day.